Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Balloon Kyphoplasty. Introduction. Back pain caused by a vertebral compression fracture, or VCF, is a common condition that affects thousands of people every year. Doctors may recommend balloon kyphoplasty surgery for people suffering from vertebral compression fractures. If your doctor recommends kyphoplasty surgery for your VCF, the decision whether or not to have surgery is also yours. This patient education tutorial will help you understand better the benefits and risks of this surgery. The tutorial discusses the causes and symptoms of vertebral compression fractures and its alternative treatments. The benefits and risks of balloon kyphoplasty are discussed, followed by what to expect after surgery. Causes of VCF. The spine protects the spinal cord and nerves that go to different parts of the body. The spine is formed of solid vertebrae. The vertebrae are separated by softer discs. This is how a normal spine looks from the side. This is how a spine with VCF looks. The cracks in the vertebrae cause the spine to curve and weaken. Osteoporosis, a disease that makes bones become weak and easier to break, is the leading cause of vertebral compression fractures, or VCF. There are many factors that may lead to osteoporosis and vertebral compression fractures. Menopause, asthma, diabetes, rheumatoid arthritis, and vitamin D deficiency, as well as use of some drugs, can make a person more likely to get osteoporosis and VCF. Certain types of cancer and tumors can also cause vertebral compression fractures. Your risk of getting additional fractures increases a lot after your first fracture. This is because one fracture can cause the spine to become curved. When the spine is not aligned correctly, the stress of holding up the body incorrectly may lead to multiple fractures. As more and more vertebrae break, the spine starts bending forward. This is known as kyphosis. Symptoms of VCF. Symptoms of VCF can happen gradually without any specific injury. Sometimes a person can have a VCF and have no symptoms at all. The symptoms of VCF may include long-term and dull back pain, sudden and severe back pain, stoop posture or kyphosis, loss of height, and decreased appetite. Doctors diagnose a VCF with radiographic images such as X-rays, MRIs, CT scans, and nuclear scans.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Treatment options. After diagnosing VCF, the doctor may prescribe a brace, bed rest, and medication for controlling the pain. This will not treat the shape of the spine, which may cause future VCFs from stress. The use of a brace may help with the symptoms. Doctors may recommend a procedure known as vertebroplasty. In vertebroplasty, the doctor injects medical cement into the vertebral fracture. This may treat the fracture, but does not treat the spinal deformity. Because of this, doctors may recommend balloon kyphoplasty. The word kyphoplasty means correction of the kyphosis. Balloon kyphoplasty treats the pain and the spine deformity. Most patients report large improvements in pain within hours of the operation. Surgery. Balloon kyphoplasty is a minimally invasive treatment. This means that it does not require any large incisions. Balloon kyphoplasty can be done under either local or general anesthesia. Your anesthesiologist will talk to you about which option is best for you. X-rays are used during the operation to make sure that the needles, balloons, and cement remain inside the broken vertebra. Your doctor will make 1 or 2 small incisions in the skin, about 1/4 of an inch in length at the level of the fracture. Long, hollow needles are then inserted through these small incisions all the way to the broken vertebrae. A small piece of bone may be taken to make sure that the fracture was not caused by cancer involving the vertebra. This is known as vertebral biopsy. Then, 1 or 2 small balloons are put through the hollow area of the needles and into the vertebrae. The balloons are then inflated. This will help raise up the collapsed vertebra to its normal position. This is known as reducing the fracture. The earlier a kyphoplasty is performed after a fracture, the more successful the reduction is. The balloons are then deflated and removed. An empty space is left behind where the balloons once were. The empty space is then filled up with a special cement mixture. The cement supports the vertebra and helps prevent additional fractures that may have been caused by an unstable spine shape. When the cement is first injected into the vertebra, it has the consistency of toothpaste. In a matter of minutes, it becomes extremely hard. Your doctor will tell you how long you are likely to stay in the hospital. Depending on how healthy you are, you may go home the same day or within 24 hours. Patients with medical problems such as heart and lung issues may need to stay longer. Risks and complications. This operation is very safe. There are, however, several possible risks and complications which are unlikely but possible. You need to know about them just in case they happen. By being informed, you may be able to help your doctor detect complications early. The risks and complications include those related to anesthesia and those related to any type of surgery. Risks of general anesthesia include nausea, vomiting, urinary retention, cut lips, chipped teeth, sore throat, and headache. More serious risks of general anesthesia include heart attacks, strokes, and pneumonia. Your anesthesiologist will discuss these risks with you and ask if you are allergic to certain medications. Blood clots in the legs can occur due to inactivity during and after the surgery. These usually show up a few days after surgery. They cause the leg to swell and hurt. Blood clots can become dislodged from the leg and go to the lungs where they will cause shortness of breath, chest pain, and possibly death. It is extremely important to let your doctors know if any of these symptoms occur. Sometimes the shortness of breath can happen without warning. Getting out of bed shortly after surgery may help decrease the risk of blood clots in the legs. Some of the risks are seen in any type of surgery. These include infection at the skin level, bleeding, skin scars that may be painful or ugly. Other risks and complications are related specifically to this surgery. These again are very rare, however, it is important to know about them. Before it hardens, the cement could leak into the muscle, the blood vessels, and tissue that surround the spinal cord. After the cement becomes hard, leakage cannot happen, so this risk can only happen within minutes of injecting the cement. Small amounts of cement leakage in the surrounding muscles or discs are usually not a problem and do not need treatment. Large amounts of cement leakage around the spinal cord or nerves could lead to paralysis. Such leakage may have to be treated with an urgent spine operation to try to take the cement out. This risk is extremely rare. The needles used can injure the nerves, spinal cord, lungs, and big arteries and veins in front of the spine. Such injuries could lead to paralysis and possibly death. Urgent surgery to fix such problems may be needed. This risk is also extremely unlikely. If the original reason that led to your fracture is not treated, new fractures could happen. After the surgery, no repetitive bending or twisting or heavy lifting is allowed in the few weeks following the operation. You may want to place items you will need at a lower level in your home prior to surgery so that you can reach them easily after the surgery. Remember that the fractured and now treated vertebra is probably the sturdiest vertebra in your body. Further restrictions such as no heavy lifting, no bending, and no twisting aim at preventing other vertebrae from breaking. Such restrictions may have to be followed for the rest of your life. Fractures involving other vertebrae are very common. Osteoporotic patients can break their vertebrae by simply sneezing or coughing. This is why it is very important to have the osteoporosis treated. It is also important to realize that no osteoporosis treatment makes the bone immediately as solid as it used to be. It takes a very long time to strengthen the bones. This again is why patients have to be very careful not to stress their spines with heavy lifting, bending, or twisting. Most patients are allowed to walk after the surgery for as long as they can tolerate it. After this period of relative rest, physical therapy may be necessary to allow you to resume your previous activities. Whether or not you will be able to resume all previous activities depends on how well you are doing at the time of your follow-up. Your doctor will tell you how long it will take before your back is completely healed and when you can go back to work and normal activities. That depends on your age, type of work, degree of osteoporosis, and general medical condition.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Balloon kyphoplasty is a minimally invasive surgical treatment that can successfully treat vertebral compression fractures. This operation is very safe with excellent results. However, as you have learned, complications may happen. Knowing about them will help you detect them early if they happen.
Thank you for using Explain.